evening, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team. And I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itch a lot. It may be due to the chemicals in certain food items, allergy to certain medication, insect stings, sunlight, and sometimes the cause is even unknown. As per study published in Indian Journal of Dermatology, Venereology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self-medication can actually worsen these symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment, and management approach for an early relief. So today, we have with us renowned dermatologist of India, Dr. Sanjay Dayani, live from Nagpur, Maharashtra. He will educate us more about urticaria and its management. Dr. Sanjay Dayani is a M.B.B.S, DVT, dermatologist, and cosmetologist. A very warm welcome to you, Doctor.
Thank you, Sam.
Doctor, it's a pleasure to have you with us. And today, as we are going to talk about one of the most important topics, right, which is urticaria. And it is important because it's very common. First of all, Doctor, we would like to understand what is urticaria? Urticaria hota kya hai?
So, as you know, the skin is the largest organ of the body, and every time the patient comes to a clinic of a dermatologist, the most of the time the complaint is urticaria. So, जब भी patient हमारे पास आते हैं, तो sometimes they have a very classical complaint. I can say most of the time they come without any symptoms. Sir, मुझे ऐसा हो रहा था, अभी नहीं है. So this is the most of the time. Like they come to us, and urticaria basically also called as hives, wheals, or even they are called as welts or nettle rash. So basically ये raised itchy rash रहता है जो which appear on the skin, and it can appear on any part of the body. Like the skin is the largest organ, and you can imagine any part of the body you can have urticaria. And the most important part, the what really get patient to us is the itching. So it's a very severe itching the patient has. Sometimes the patient might be asymptomatic, like they don't have any complaint, but most of the time the patient has severe scratching, like which really disturb their lifestyle, like getting up in the night and scratching. Sometimes the scratching is so severe, like the patient usually scratched up to the extent of bleeding, and these patches usually they range from the patient usually tell you some छोटे spots are like ranging from few millimeter, and sometimes it might go up to a size of a hand. And the rash usually the affected area may change. Like patient comes to us, आज यहाँ पे हुआ था, आज body पे पैरों में हो रहा है, कल मेरे हाथों में हो रहा है, कल face पे हो रहा है, ठीक है? And typically the rash usually disappear after few minutes or few hours, and usually it won't last longer than 24 hours. And usually the rash settle down in few days.
Mhm. Okay. So this is basically urticaria. What are the causes responsible for urticaria, doctor?
So it's a very like whenever the patient comes to us, if someone asks us like urticaria, any reason is that. So most of the time, if you Google it, like you will come to know, most of the time it's very difficult to find out the reason behind the urticaria. So when patient comes to us, usually we tell them if they have some very particular thing they remember which has aggravated this thing. So the common thing which we come across, the patient tell us the things they very commonly tell us, the things which they really attribute the urticaria to. The most common is the cold or the heat exposure, and Commoner than that is the sometimes they usually give history of some food allergy. I have consumed this probably because of I have developed this. डॉक्टर साहब हो सकता है कि मुझे कुछ इंसेक्ट बाइट हो गया हो and particularly in children this is very very commonly seen after an infection. So in usually children we attribute urticaria to any infections and usually we try to give some we try to treat the infections and sometimes the patient have very classic history of medication. The doctor, I went to that doctor, I have some pain and all, so they gave me some painkiller or some other drugs or antibiotics. And typically, I developed after that. So the common causes, as I mentioned, it can be allergic reaction, something to some food allergy or reaction to insect bite or sometimes sting. Or patient might have some cold or heat issues like after cold exposure or the after heat exposure, we might have developed that. Sometimes because of infection and sometimes he might have this because of drugs.
Right. So there can be n number of reasons behind urticaria. Now, the thing is, doctor, we would also like to understand: is it a kind of skin allergy?
Yeah, it's a skin allergy. If you medically ask me, it's a type 1 reaction. It's a
Oh.
type 1 hypersensitive reaction. And
Mhm.
usually patient develop because of the type 1 reaction. And sometimes this can go for some very rarely it happen. It might go for anaphylaxis. That is a very severe. You can say that like the patient is at risk.
Okay, we'll also talk about that in detail later. But right now, because you know what happens uh, when some allergy takes place, then we in our society have this tendency of going to the chemist shop and buy a over-the-counter, anti-allergent, and that do gives us some kind of relief. और हमें लगता है कि बस ये ठीक हो गया है और जैसा आपने कहा भी कि जो अर्टिकेरिया होता है वो कुछ घंटों में ठीक भी हो जाता है, फिर दूसरी जगह होने लगता है कई बार, तो इस तरह की चीज़ें होती हैं। तो ये जो हम खुद से जाके एक एंटी एलर्जेंट ले लेते हैं या कुछ और करते हैं जहाँ पे हमें इच हो रहा है, इज़ इट ओके टू डू? इज़ इट ओके टू डू प्रैक्टिस और ये डेंजरस हो सकता है?
Uh, Definitely the medical help is very very important. But in cases like most of the time, as you mentioned before, like in your introduction, it's a very common condition.
हुँ,
So a patient having recurrent, like maybe you must be aware of this thing. So in these cases, usually we tell the patients there are few things which he can do it on own. As you mentioned, like medication. So medication for urticaria, like it's okay if he take some antihistamine on his own, some mild antihistamine drugs he can take. The two three drugs which are very very safe, like I can name them cetirizine, fexofenadine. If he give the history, I have taken this drug on my own, so I will say it's okay. But it's a time when the patient is not comfortable after few days. The recurrent is there. The disease is coming back again and again, and the severity is increasing. So that is a time where he need medical help because it can become an improve. So medical help is very, very important. I think for every case, unless if your patients like that are not possible to get medical help immediately.
right. And as you also said, there in some incidences it can really become very dangerous or serious. We would like to understand, doctor, how serious can urticaria get? क्या ये लाइफ थ्रेटनिंग भी हो सकता है? ये हम आपसे जानना
Yeah,
चाहेंगे।
sometimes this disease can be life threatening. Most of the time, it's a mild allergic reaction or sometimes mild to moderate, but sometimes it can, as I told you, it can lead to anaphylaxis reaction. Like in this cases, the patient usually might develop some other complaint apart from itching. So this patient usually they come with complaints like sir, I'm developing some increase in heart rate, some tiredness, or sometimes the patient is very, very like uncomfortable. So that time it can be like maybe a symptom of anaphylaxis. So this has not to be neglected. And in this cases, I usually tell them to immediately rush to the hospital. They might develop trouble breathing or swelling of the tongue, sometimes swelling of the lips and mouth, and they had to be immediately taken care by in fact, I can say they has to be hospitalized.
Okay, so that's why it's important to understand what is urticaria. और ये पूरा सेशन करने का हमारा जो ऑब्जेक्टिव है वो ये भी है कि हम अवेयरनेस पैदा करें अर्टिकेरिया को लेके, ताकि हमें पता हो कि अर्टिकेरिया क्या होता है, कैसा दिखता है, क्यों होता है, और अगर हो तो हमें क्या करना है। हमें क्वालिफाइड स्किन स्पेशलिस्ट, एक क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाना है और सेल्फ मेडिकेशन से बचना है। कई बार ऐसा भी होता है डॉक्टर, हम सिम्टम्स को इग्नोर करते हैं, बहुत ज्यादा इच हो रहा है तो बहुत ज्यादा इच कर रहे हैं। डेफिनेटली ये हमारे क्वालिटी ऑफ लाइफ को तो हैम्पर करता है, लेकिन अगर ट्रीट नहीं किया जाए तो क्या कुछ कॉम्प्लिकेशंस हो सकते हैं?
Urticaria is more like if you say the lifestyle is very disturbing because of this condition.
Right.
So the patient is like sometimes usually even if he has a mild urticaria, the routine of the life is very disturbed. Like usually patients are not comfortable. The patient are worried about consuming some oral drugs, or sometimes even they are very afraid of eating something. So because they are always in phobia. Like for example, a patient want to travel somewhere, he's always in they're always in back of the mind. I won't be able to like if I develop reaction while traveling, what happens? So this is the one reason the lifestyle is very much affected because of this. And second thing, as I mentioned before, anaphylaxis. Sometimes you never know, like patient develops some kind of severe reaction. So that is the main thing where patient has to be very careful. So these are two things: the lifestyle and fear of developing anaphylaxis on part of doctor. It's very important. So that is a thing. Like so, you have to take it very seriously.
Right. In last 2-3 years, especially when COVID is still there, it has not gone anywhere, but still, when the cases were more, we have seen patients complaining about getting urticaria or hives when they were infected with COVID. तो क्या कोविड या किसी दूसरे तरह का इन्फेक्शन से भी अर्टिकेरिया का कोई कनेक्शन होता है डॉक्टर?
The urticaria can be because of some infection. It can be like you're talking about the reason related to infection, right? So it can be because of infection, particularly in children when they come to us, they might have developed this urticaria because of some infection. So if children coming to you, classical history of urticaria, so we have to give some antihistamine along with we have to treat that underlying infection.
So when a patient comes to you with urticaria or whatever problem they have, it might turn out to be urticaria. Are there any tests that you normally suggest, or how do you diagnose?
The classical, usually the diagnosis is with the usually urticaria diagnosis is usually done with it's a clinical diagnosis. So most of the time when patient comes to the doctor, it's very easy to diagnose the case. So clinically you can judge. Even patient coming to you and he having no patches on the body, the classical history he gives to you. So that is more than enough to diagnose the patient. The patient, even the patients are so aware of this thing. Sometimes they get photographs to us. These are the patches I usually develop, and I have developed this at night. By the time I came to you, it has disappeared. So the classical history is very clear for the urticaria. So and sometimes when we have some suspicion, it might be some other disease. So or if we want to find out the cause, so usually we do go for some investigation. So the common investigations, the first of all, we usually look for the complete blood count. So complete blood count usually sometimes it gives you some hint of some infection, or sometime it can give you lead to some kind of like if you have mass hemoglobin, anemic patients are also prone for developing urticaria. In other cases, like sometimes we look for the test like we look for the auto immune test. So sometimes autoimmune patients, the patient with autoimmune disease, they are also prone to develop urticaria. So in cases, if some patients are there who have some autoimmune history, we do all the autoimmune tests in the patients. Even the disease like some associated disease like thyroid. So even thyroid disorders, these patients are very prone for developing all like urticaria. So we usually get thyroid done of this patient. We do usually TFX for the patient, and like it really help us to diagnose Even most of the time, a lot of doctors do the stool test and urine test, sometimes to rule out the infection. And occasionally, we do some skin tests. It's very rare. Like in my practice, I rarely do it. So we do some tests like autologous serum skin test. So this is a test where we like inject the serum into the skin to see the reaction on the body. So that is one of the very not done very commonly, but this is one of the tests we usually do autologous serum test. And sometimes when we have typical urticaria, like the patient has urticaria which is like lasting like more than 24 hours. As I told you, classically urticaria should subside within 24 hours. And
Mhm.
patient time coming you with the history of like lasting more than 24 hours. So sometimes we can think of some other indication, other skin disorders. So that time we usually also go for the skin biopsy. So skin biopsy is very helpful in other conditions.
राइट तो इसीलिए जो भी सिम्टम्स हैं उन्हें हमें इग्नोर नहीं करना है, जो साइंस है उन्हें हमें इग्नोर नहीं करना है। अगर कुछ भी एलर्जी लग रही है स्किन पे, कुछ भी है जो व्हिच इज नॉट यूजुअल, व्हिच इज नॉट नॉर्मल, प्लीज गो एंड कंसल्ट अ राइट पर्सन व्हिच इज a qualified dermatologist. Doctor, as you said, it's important to investigate few things so that you can find out the cause. और जब cause पता चलता है तब उस पहले हम उस cause को, उस trigger को दूर करने की कोशिश करते हैं and the treatment follows. Now, many a times what happens, because initially you said कि food poisoning और दूसरी food and allergy और दूसरी तरह की allergies की वजह से भी कई बार urticaria होता है. There are people who are allergic to certain things और कई बार उसकी वजह से होता है. Now, what people do in general, despite going to the doctor, they'll go to the lab and get their food allergy test क्योंकि आजकल बहुत common है. They are not that so comfortable on our pockets, but still क्योंकि वो एक ट्रेंड में है तो लोग जाते हैं और अपना फूड एलर्जी टेस्ट करा के आ जाते हैं और उनको पता चलता है दे आर एलर्जिक टू से 32 और 50 फूड आइटम्स और वो सब अपने थाली से ओमिट कर देते हैं. आपका इस पे क्या स्टैंड है? I mean, going to the lab all by our own, getting a test done.
Usually like the market is like full of this kind of test. So and so these patients are very prone for the this kind of investigations. So usually we never advise the food allergy test for the patients because it is not very helpful. So my take on this it's like usually there is no need of this food allergen test. Usually it's very common. Usually what they do, they give you some, they inject, this is also called a skin prick test. So usually performed by dropping some allergen on the lower forearm and reading the result after 15 minutes. And usually is not very helpful. So most of the time it is like mm, more of like wasting money. So usually my take is like just avoid this. Very rarely this might be very clear cut. Like the patient comes to us and classically he tells me, sir, I have allergy with peanuts or shellfish, egg or cheese. That time it's okay. Even that time I don't think test is required. But this is the only place where I can advise this test. Otherwise, this test is not helpful.
Right. And again, many times, even if you have said that, n number of reasons could be responsible. बहुत सारी वजहों से अर्टिकेरिया हो सकता है, लेकिन कई लोगों को लगता है कि अगर अर्टिकेरिया हुआ है तो किसी तरह की फूड एलर्जी से हुआ होगा. और आम तौर पे जो एक ब्लैंकेट लिस्ट होती है ना कि कई लोग कैशू से एलर्जिक होते हैं, पीनट से होते हैं, सी फूड से होते हैं, अलग अलग तरह के प्रोटीन से होते हैं, डेयरी आइटम से होते हैं, तो हमें उस वजह से अर्टिकेरिया हो ना हो हम वो सब खाना बंद कर देते हैं.
Right.
ये भी बहुत होता है, तो उस पे आप क्या कहना चाहें?
Patient usually like in our Indian culture, like it has been like this disease is because of food allergy. Most of the time, like even not only urticaria, in all the skin conditions, the patient has last question, sir, like what I have to stop? What is the thing which is really troubling me? So what can I stop? What like they call it? Doctor साहब परहेज क्या करना है? So परहेज mean is not like other परहेज. Pरहेज is like what I have to avoid. So this is very common uttered by every patient. So in particularly urticaria, like there are definitely few food allergens are responsible, but in most of the cases, the food allergens are not responsible. So if I tell them something, they avoid this, and I know if the thing is that that is not the reason. So that will be like a patient will lifelong remember that, and he won't eat that, although that is not the particular reason behind the allergy. So usually try to avoid the uh, tell them to avoid anything unless they are very clear cut. Unlike very, they are very, sometimes we do tell them to do challenge tests. For example, someone tells me like I'm allergic to fungus, to peanuts, so I tell them to avoid peanuts for at least 14 days and try again. And if he develops, so we usually tell them like he can stop that peanut and all. Otherwise, usually we avoid telling them to do all this parage and all.
राइट होता क्या है कई बार जब हम इस तरह की एक भ्रांति में रह के सब कुछ अपने थाली में से ओमिट कर देते हैं तो हम ऑल द इम्पोर्टेंट न्यूट्रिएंट्स एक्सेट्रा वो
Yeah.
उनसे हम वंचित रह जाते हैं तो बहुत जरूरी है कि सेल्फ मेडिकेशन हम ना करें डॉक्टर से सलाह लें ऑनलाइन बहुत सारे इन्फ्लुएंसर्स हैं ओवर द काउंटर मेडिकेशन है बट ये सब हमारे लिए बहुत ज्यादा हार्मफुल साबित हो सकती है तो प्लीज go and take advice from a qualified dermatologist. एक हमारी व्यूअर है वंदना नरवरिया पूछ रही है आर देयर एनी होम रेमेडीज और नेचुरल ट्रीटमेंट्स दैट कैन हेल्प रिड्यूस द फ्रीक्वेंसी और सिविरिटी ऑफ हाइव्स
In these cases, like as the patient has to be very comfortable once he develops this problem. So when you, I won't say the natural remedies. I will say like what he can really do is a self care. So usually, patients I usually tell them to use some cold compresses. This really help them. Avoid wearing very synthetic clothes like woolen clothes. We tell them to usually wear something very comfortable cotton clothes. Avoid sweating. This really help you out. And cold compresses really work well. And what really patient only tell us regularly. So whenever I develop these patches, I apply this coconut oil, and I'm very happy. So that really helps. So coconut oil. As a dermatologist, sometimes we do prescribe lactocalamine lotion, which has some cooling effect on the lesions. So, and even like a lot of patients, which they were telling me they're using this aloe vera, tea tree oil, white hazel, green tea, ginger, turmeric, many more. So definitely this give a very temporary soothing effect. So that way these are very effective. But as a part of treatment, I won't recommend. This is just to a temporary relief. So we were talking about the natural treatment. So usually the hives, whenever the patient develop hives, we usually tell them to start using some antihistamines. This is the mainstay of treatment for the urticaria. So there are a lot of antihistamines available in the market. So the common we usually need something like we call H1 blocker. So there are a lot of antihistamine which we usually advise to every patient, prescribed to every patient. The commonest antihistamine drug given to the patients are the uh, cetirizine. Then we have this fexofenadine. Then we have this new drug nowadays, the bilastine. So there are a lot of and the patients are really happy with this drug. Sometimes the patient has to be given a high dose drug. Like for example, patient coming to me, I'm prescribing simple cetirizine, 5 milligram, cetirizine 5 milligram HS, and patient is not comfortable. So sometimes we have give this drug on a higher dose. We have to prescribe this drug for at least for 2 times or 3 times. So that really helps. Sometimes the patient is not comfortable with this oral antihistamine. That time we have to usually sometimes we have to think of the other kind of drugs we call oral steroids. So mind well, the oral steroids we usually restrict to only cases which are not responding to treatment. So occasionally we add oral steroids like betamethasone kind of prednisolone drugs, and this drug has to be tapered off immediately. This really work wonders. This are the major drugs for urticaria, but that has to be given for very short term because of the side effect of the drug, like gastritis or some dependency or some bone facies and all. So we always restrict using of a lot of oral steroids. And sometimes occasional people not responding to steroids, that time we switch over to drugs we call immunosuppressant. So that sometimes we do need to give very powerful drugs for this condition.
Right. And many times, doctor, patients with urticaria complain that their urticaria get worse during night. तो क्या रात को अर्टिकेरिया के और ज्यादा एग्रेवेट होने के भी कोई रीजंस हैं?
There is a theory like they say जो हिस्टामिन जो रहता है मॉलिक्यूल जो which is responsible for urticaria, usually it level increase in the night. So there's a study was done where they saw the histamine level was increased at night. So there, that was one of the theory they have told. So probably maybe one of the reason of most of the patient coming to us, this is very typical. Like patient comes to us, I have developed this itching rashes, particularly at night. That's why they turn up in the clinic in the morning. So
Mhm.
that is, I think, one of the reasons the patient usually develop the itching at night.
Right. And many a times patients complain. You also mentioned they get very tired or fatigued. Maybe it's due to, because they're continuously itching. Or there are any other factors also responsible for this, doctor?
Usually the patients are more, as I told you, like they are worried about the lifestyle. Lifestyle is like they are frustrated, like they are worried about traveling, they are worried about like the the job quality is affected. Students studying in classes, like they start bunking the classes because of because of the medical reason. So the females working at the housewives usually they are not comfortable with while they because the kind of the housewives the kind of exposure they have with the heat, like because they sweat a lot, so it can get aggravated. So
Right.
usually the lifestyle is very much affected, particularly elderly patient and very small kids, which are like patient, even the kids at the age of 1 year, 2 year, 4 years, they're coming to us like developing articular rash, they become very irritated. So because of the parents usually suffer a lot. So the lifestyle is too much affected because of the disease. So it has become very, particularly, if you can say this has become looks like a simple disease, but the patient suffers a lot in terms of lifestyle.
Yeah, we can imagine because the patient's lifestyle is hampered, and many a times, as you were also telling, that they avoid going out or going in public or socializing, and that increases their stress. Now, doctor, does this stress, because they are definitely under so much of stress, is going to aggravate their condition?
Yeah, stress urticaria is something we call. So the stress does affect their urticaria. So usually, what we really find out, like usually this acute cases they go for the chronic because of the stress. So when we say acute, like very short disease, but this patient become very chronic. This disease become a chronic condition. So this will be really a prolonged disease.
Right. Kalpana, a viewer is asking, what is your advice, doctor, for toddlers with urticaria?
So usually toddlers like it's very common in kids. So whenever the patient comes to us, immediately this particular toddlers we have to handle with care because usually we just try to give them minimum medication because of the age factor and the weight factor. So in these cases, usually the lifestyle is very important. As I mentioned before, the application of coconut oil or lactocalamine, and apart from that, avoiding sweating, avoid hot and humid climate, even avoiding very cold climate. So the basic care, avoiding woolen clothes, and apart from that, usually we put them on mild antihistamines, which really helps.
Right. Ria is asking a similar question as you were mentioning, the avoid extreme temperatures. Her question is going outside during the summer, will it worsen my urticaria?
Particularly patient having a uh, cholinergic urticaria or solar urticaria. So that's the physical kind of urticaria we call solar urticaria, where the patient develop urticaria because of sun exposure, because of the heat. So, so increase in body temperature, so he will develop like physical urticaria sometimes. So, if the patient having solar urticaria, we strictly tell them to avoid sunlight and they have to be more like on medication and sunscreens and all and moisturizers.
Right. A very common question which the patients who are suffering from urticaria generally ask is that, will it go away permanently? Will I get a permanent relief at any point of time? What is your answer to that, doctor?
Okay, so this is the question day to day by every patient to us, and
Mhm.
every time they come, they are the same question. So, in particularly in a chronic urticaria. So
Right.
when I say chronic, like the patient having a disease lasting more than 50 and up to years. So usually, in our experience, everyone get cured. Few patients take few months, but sometimes there are occasional patients who take years, maybe more than 5 years, 10 years, or many more. But usually everyone is getting cured.
राइट कई बार पेशेंट्स ये भी पूछते हैं कि जैसे डायबिटिक्स हैं या हाइपरटेंशन के मरीज हैं उनको लाइफ लॉन्ग मेडिसिन लेना पड़ता है क्या यही अर्टिकेरिया के केस में भी होता है स्पेशली क्रॉनिक अर्टिकेरिया में कि हमको पूरी जिंदगी दवाई लेनी ही है
As I mentioned before, like very occasional patient I have seen who have to take this drug for so many years. Otherwise, most of the patients, not like diabetes or hypertension, they take lifelong. Most of the patients usually get cured by maybe after a long time, but they get cured. So occasionally, in my practice of 23 years, I might have seen one or two patients who are still on medication since last 20 years. Otherwise, 99% patients or more than 99 they have stopped the medication.
राइट इसीलिए जरूरी है कि अगर हमें अर्टिकेरिया हो रहा है तो पहले तो हमें पता हो कि अर्टिकेरिया क्या होता है और अगर सिम्टम्स सिमिलर हैं तो प्लीज गो एंड कंसल्ट योर डॉक्टर दैट्स रियली इम्पोर्टेंट डॉक्टर और जब हम डॉक्टर की बात करते हैं बहुत सारे क्वैक्स भी हैं आजकल इन्फ्लुएंसर्स जो सोशल मीडिया पे है वो भी बहुत ज्यादा लोगों को इन्फ्लुएंस कर रहे हैं डेफिनेटली दैट्स व्हाई दे आर द इन्फ्लुएंसर्स प्लस हमारे पास बहुत ज्यादा इन्फो ऑनलाइन भी अवेलेबल है तो जैसा कि हमने पहले ओवर द काउंटर मेडिकेशन पे बात की होम रेमेडीज पे बात की कई बार हम ये भी करते हैं कि जो इन्फ्लुएंसर्स बोलता है वो सुन लेते हैं क्वैक्स को फॉलो करने लगते हैं या फिर ये भी कई बार हम करते हैं कि हमारे जो फ्रेंड्स या फैमिली दोज हु हैव गॉन थ्रू दी सिमिलर फेज जिनके इसी टाइप के सिम्टम्स थे हम कई बार उनका प्रिस्क्रिप्शन लेके भी चले जाते हैं केमिस्ट के पास और जो दवाइयां उन्हें दी गई थी उन्हें हम भी फॉलो करने लगते हैं दो वी अंडरस्टैंड prescriptions are normally tailor made सबके लिए अलग prescription होता है लेकिन अगेन इस तरह से क्वैक्स या इन्फ्लुएंसर्स या फ्रेंड्स एंड फैमिली के प्रेस्क्रिप्शन को फॉलो करना ये कितना डेंजरस हो सकता है
This is very, very dangerous. Usually what happens, the prescriptions given by quacks or some other doctors who are not qualified, usually these prescriptions are very effective because of steroids. So usually these doctors, without knowing the side effects of steroid, they right and left, they prescribe steroids to every patient. So which is not required. Most of the time the patient can be taken care by antihistamines or some mild drugs. So this is a very like this become a havoc. Sometimes if a patient is taking steroid and is very comfortable, and it might happen he won't be following that quack also, and he's not going to doctor and he's taking steroid lifelong. And because of this oral drugs, he might develop some other disorders like other diseases like as I mentioned, like skin issues, like or sometimes he develop metabolic disease like hypertension or and he become diabetic. So it's always like even we have few patients like we put them on steroids sometimes because of this issue and they never follow up the doctor and they keep on taking this drug. So if this can happen with us, so it's very very common with like quacks, like they won't follow them and they keep on taking drugs on their own. So it can become a very emergency issue.
राइट तो इसीलिए बहुत जरूरी है कि हम एक क्वालिफाइड डॉक्टर एक क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाएं और trusting your doctors equally important they know our skin they know the problem that we are going through इसलिए जो भी वो कह रहे हैं उसे फॉलो करना भी बहुत जरूरी है one more question doctor is urticaria contagious
No, it's not contagious. It's a definitely it has some genetic role, but it is not contagious.
I'll take few more questions from our viewers. Firoz Khan is here asking, can allergies cause high blood pressure, doctor?
No, no.
No.
Allergy
Okay.
can cause high blood pressure. Allergy might because of sometimes if patient develops some severe kind of allergy, he might if he develop anaphylaxis and all, that time this can be the issue. But otherwise, allergy has no relation with high blood pressure.
Okay. Manaf Khan is here asking, what is your experience in the treatment of cold urticaria?
Cold urticaria is something where the patient has, this is also called as physical urticaria. So whenever patient comes in contact with some cold water, like while taking bath with cold water, this patient usually develop this flares on the body, raised irrigated skin on the body when whichever part is coming in contact, and this starts severe scratching. So cold urticaria is a very very common thing nowadays. and that has to be taken care with antihistamine and avoidance of cold. And in my cases, most of the time, even the patient was complaining like he was allergic to cold water. Over a gradually period of time, he came to me and he said, right now he's comfortable with the cold water. So most of the time, patient usually change, like they improve.
राइट बहुत सारी बात हमने अर्टिकेरिया पे की है डॉक्टर और बिफोर वी सम अप द होल सेशन व्हाट विल बी योर टेक होम मैसेज फॉर आवर व्यूअर्स और एनीथिंग दैट वी हैव मिस्ड ऑन दिस वेरी टॉपिक
Urticaria, I should say, like the patient is aware of this condition. That's a very good thing. And as you mentioned before, most of the time, whenever they scratch, they should go to a proper medical professional, particularly dermatologist. They are the doctors for the urticaria, and follow the treatment regularly. Particularly, I just advise them. Urticaria is a disease where like treatment is taken properly, it won't be prolonged. And if you are like not following medication regularly, you have to face the disease for years. So that's very important because it can affect your lifestyle. It hampered your like mind overall development. So that is very important to take a proper treatment. And take home message is urticaria is a very mild thing to have. So nothing to worry about it. Just take proper treatment and you will be happy.
Thank you so very much, Dr. Sanjay Dayani, for your valuable time, sir. And it has been a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, at least now they know that instead of self-medication or over-the-counter medication, it's better to approach a nearby qualified dermatologist. It was great to hear you. Thank you once again.
Thank you. Thank you. Thank you.
And viewers, thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Good day. Goodbye.
Bye-bye.